today's event. I just wanted to let you know that the commissioner is a little bit delayed by about 5 or 10 minutes, so we'll just be starting at around 10 past, if that's okay. Apologies. Hello, everyone. I'm delighted to be here today and welcome you all. My name is Shona Murray. I'm a journalist with Euronews and I'm chairing today's event, How to Ensure Decent Work and Job Quality for Essential Workers, organised, of course, by Eurofound and International Labour Organisation. Just a few housekeeping notes before you start. For your safety, note the exits in the room. It's a small enough room, so not too hard. If the alarm sounds, you should leave the room calmly, quietly. The event is in English. There isn't any interpretation. You can discuss what we're talking about today on social media using the hashtag essential workers, so feel free to share your views on that. There is a photographer here, as we said earlier. The event will also be recorded, so just keep that in mind. And we will be going to the audience for our panel at the end, so we'd really like you to engage and keep your comments or lively questions that you have. And there's also going to be a networking lunch downstairs in the restaurant just after 12:30 when the event is open, so you're very welcome to turn to that. Now, the ILO and Eurofound have cooperated on a range of issues over the past decades. Job quality and decent work have consistently been atop of the agendas. And as we know, the COVID-19 pandemic put the spotlight on the vital role of so-called essential workers, which has been broadly and widely acknowledged and recognised in the midst of the crisis, and of course now. These were the workers who kept society and all our services going during the health crisis and the restrictions and the lockdowns that followed. These workers often put their own health at risk to help others. So we're here today to reflect on how their important role continues post-pandemic. And we're thrilled that we'll be hearing from the European Commissioner Schmit, the Commissioner for Jobs and Social Rights. He'll be here to speak to us presently. And from the European Parliament, a warm welcome to Alicia, MEP. So following their introduction and overview, our ILO and Eurofound experts will present their various evidence-based findings built from different data sources, and hearing from the policymakers, followed by the experts. That'll set us up nicely for a discussion with a panel of social partners from essential sectors, who of course have been working on the ground to explore the main challenges that they're facing and how they're preparing for the future. So also, as I said, there will be an opportunity for questions and comments. So we look forward to that part as well. So without further ado, though, let me introduce our first speakers, Ivailo Kalfin, Executive Director of Eurofound, and Lieve Verboven, Director of the ILO Office for the EU and the Benelux countries. Thank you.
Thank you very much, Shona, Mr. Commissioner. Lieve, ladies and gentlemen, welcome to this event. I'm very happy to welcome you here, and that's another event we are organizing. Eurofound is organizing together with ILO, and we indeed have a long history of joint work and joint analysis on social dialogue, on telework, but essentially and mostly on working conditions and job quality. I have to tell that I have a little problem with the title of today's meeting, because if we have essential workers, then we should have some non-essential workers. Maybe we have to think about some other appellation indeed of these people that made Europe run during, not only Europe, during COVID and during the lockdowns. We are trying at Eurofound to use critical workers, but maybe this is not the one. Anyway, I mean, the term is probably still going to be looked for, but we try to analyze what happens there. And what happens there is something which is very much attracting the attention of researchers and policymakers, especially after COVID, because we see that especially where these people are working, we don't have that much high level of automation. Artificial intelligence is a little bit away. You need in-person services. You need personal people's presence there. So humans are essential in most of these functions. At the same time, if we look at the job quality, and you can take different aspects, I would, for example, take the long-term care or the care workers. You're going to see that very often they're underpaid. Basically, across Europe, you have more than 20% lower average salary of long-term carers than anybody else. They're under pressure of stress and difficult health conditions, with much more threats in terms of health and safety at work, much more stress. They have some issues with very often in the care sector, but not only in the care sector, with non-representation. We have only 8 EU member states where we have collective agreements covering the long-term care workers. They have a number of problems, especially those that live in the houses of the people they take care in, etc., etc. So there are plenty of particular risks for the different groups. I just take the long-term care because we recently had several reports on that. But if you look at all the essential workers, I mean, transport workers, healthcare, long-term care, childcare, everything related with producing in the food industry, we are going to see that these sectors are not the most attractive for work, and they're under pressure. And today is the World Mental Health Day, so we need to mention also the threats on the mental health and the increased stress levels, especially for these workers. The good news is that, and this is very much due to the work of the Commission, and I'm very happy that Commissioner Schmit is here. We have a policy response with the minimum wage directive, for example, and we have to, and we find also in the research that essential workers very often are at the minimum wage. So the minimum wage directive is extremely important for them. The care strategy is another one which is very important for them, because they need not only decent pay, but also better training, better working conditions, better access to housing, and we have some good examples in the member states, etc., etc. So there is a policy response already, but still there is a long way to go in order to assure that those that keep our society in critical moments run need to have a more special attention, especially in terms of working conditions. And this is not about some privileged position, just the opposite. I mean, they just need to have at least the average levels as everyone else on the labor market. I know that we are going to have a very interesting panel. By the way, some of the panelists have authored some interesting reports on care workers and essential care. So I'm very much looking forward also to hear the discussion. We are presenting today 2 reports that were made by ILO and by Eurofound. The Eurofound's report is actually appearing today, right, Jorge? Yes. So this is quite new, and I can assure you that we will keep working and providing data across Europe on the situation of these critical workers and what are eventually the policy solutions that could help them feel better, that would help our society feel more secure, that in times of stress, in times of crisis, we have the essential networks and essential functions active and working. With this, I would like to stop, and again, looking forward to a very interesting discussion. I would eventually hand over to Lieve. Thank you.
Thank you, Ivailo. Ladies and gentlemen, Commissioner, Vice Chair, welcome to our event today on essential workers, but let me offer another word, key workers. Okay, good, but on your way here to the event, I'm sure chances are high that you encountered a key worker. Maybe you opened the door for the cleaner, dropped off your child at daycare, or jumped on the train just to get here in time. Just think about these everyday activities and the impact they have. And imagine a world without the childcare workers, without nurses, garbage collectors, delivery personnel. What would we do without them, right? Our societies work and thrive because of them. And that's what we are discussing here today. No matter the crisis, they keep our societies going. In these opening remarks, I want to address three short issues. First, how the pandemic has prompted us to make a study on key workers. Secondly, why I think this event and our reports are timely. And thirdly, how we can ensure that the endeavor to make working conditions for key workers more decent, how we can ensure that this is a collective responsibility. We've seen throughout the pandemic and the devastating floods and fires that our basic needs for food, for shelter and care remained unwavered. And we've witnessed firsthand the resilience of those workers that delivered the essential services. Now, it's a pressing need, it's an imperative, and it's a call to make sure that there is action for sustainable future. This urgency is also why the ILO has decided to dedicate its report, the World Employment and Social Outlook report, to key workers, to just give due recognition to their contributions during the pandemic to keep our societies and economies afloat. A function that they delivered in good and bad times, no matter what, day in, day out. And our report urges that countries invest in improving working conditions, but also more broadly, that they broaden the investment in the key sectors. The pandemic has indeed shown that underinvestment in key sectors affects the working conditions. And the objective is clear, Ivailo said it, when the next crisis hits, and the world has to be better equipped to meet the challenges head on. So my colleagues at the ILO research department to make this publication, they collected data from 90 countries and interviewed key workers worldwide, asking about their working conditions going into the pandemic and their experience during it. And from that publication, we offer policy recommendations so that we're better prepared next time. And my colleague Janine will talk about it now. We're here together as two organizations, ILO and Eurofound. And together we think this event and our reports, the one that comes out from Eurofound today, are very timely. And why do I say that? Well, Commissioner and also Vice Chair of the Employment Committee will certainly let us know. This is the time where legacies matter, where indeed we can show what has been done, but also still needs to be done. And I'm sure we will hear from you more. So yes, this is timely, but also this is a collective responsibility. A collective responsibility, why? Because our ILO study shows that key workers lack the social justice they deserve. Economic compensation and societal recognition falls short when you see which are the benefits that they bring to our economies and societies. And many low-paid key workers do job with a lot of positive externalities that are just not reflected in their remuneration or other working conditions. And failing to compensate key workers for the wider value that they bring to the societies, well, that has negative effects. And not just for them, but for society at large. We've witnessed this in staff shortages that have plagued many key occupations just coming out of the pandemic. And we've also seen that that markets overall are not fully internalizing the social and economic value of resilience. And a bit similar to that, we see that markets do not internalize environmental externalities. So we're a bit facing the same challenges. Now, what to be done? To address these shortcomings, we must leverage social dialogue to design and implement responsive policies, continue to develop them. So governments, employers and workers' organizations must work together, and at the EU level, the institutions work together to come to actionable roadmaps that can address and specific hindrances for delivering of key goods and services. Such a strategy is an investment that will certainly pay for itself whenever the next crisis hits. Thank you, and I look forward to our discussion.
Thank you, Lieve, and before that, Ivailo, Kalfin. So I'd like to now very much warmly welcome EU Commissioner for Jobs and Social Rights, Nicolas Schmit.
Good morning, everybody. I think I do not need that. Good morning, dear Ivailo, dear Lieve. So I'm very happy to be here this morning and to talk about the subject which is indeed an essential subject. Let's say it like that. And we can discuss, should we call the essential workers essential or key? What they showed us is, and you have pointed this very clearly out, without them, our society doesn't function. And finally, we discovered that during the pandemic, because for a long time, we just undervalued their role, their job, their work. And the risk is that they were very much applauded during the pandemic. You remember, on the balconies, people applauded. And the risk is that now we forget about them. And that's why your conference, your meeting today is so essential and so important, and that we have to build something new on these sectors, which finally make our societies going and functioning, because that's the key issue here. Now, the COVID-19 pandemic highlighted precisely the pivotal role that essential or key workers play in our economy and society. When the whole of Europe introduced lockdowns, essential or key workers continued to provide essential goods and services that enabled our societies to function. The pandemic also shed a light on specific risks and challenges faced by these workers, the need for improved working conditions, social protection, and skills to adapt to the changing world, and withstand current and future crises. The ongoing green and digital transitions point to inevitable transformations of the labor market. They are also making evident changing skills needs in all types of occupations and at all qualification levels, which will require workers to learn new skills or update their existing ones. The demographic evolution in Europe indicates a potential decrease in available labor force, but conversely, an increased demand for health and social care. The European working age population is expected to shrink from 64% in 2019 to 56% in 2070. We will lose 1 million workers up to 2030 each year in the European Union. Europe's aging population will, of course, mean higher demand on both the health and the care sectors. And while the population aged 65 or over will grow by 23% until 2035, projected employment growth in the care sector is just 7%, suggesting skills shortages will remain an issue. And in this context, particularly given the current unemployment rate, which is one of the lowest ever in the European Union, labor shortages and skills gaps are at the top of our agenda. As President von der Leyen said in her State of the Union speech, instead of millions of people looking for jobs, millions of jobs are looking for people. In 2022, 38 occupations were classified as experiencing a shortage, ranging from healthcare and IT to hospitality, construction and service sectors. And SMEs are struggling in particular. Despite the well-understood significance of digital skills in all types of occupation and at all qualification levels, digital skills gaps in the EU remain high. Almost half of the EU population has no or very low level of digital skills. Only 37% of adults undertake training every year. Ensuring that essential workers are equipped with the right skills, including digital skills, can improve their working conditions, as technology could be used to conduct difficult or precarious tasks in essential occupations. And while the EU has already done a lot to address these issues, clearly more needs to be done. Now, it's the European Year of Skills, and therefore this European year is a unique opportunity to respond to these changes by promoting a mindset of upskilling and reskilling, including also all the jobs in the care sector and other sectors. The year builds on a comprehensive policy framework, including the 2020 Skills Agenda, to deliver skills-related activities, initiatives, and events across the EU. The year also aims to provide impetus for existing initiatives, such as the Pact of Skills, individual learning accounts, micro-credentials, recognition of qualifications, and quality vet training. Now, on key workers, we are today discussing mainly the working conditions of these workers. It is incredible that work, which is essential and critical for society, is unfortunately not sufficiently valued. And when I say valued, it's not just a question of remuneration. Obviously, it's first a question of remuneration, and it was said that most of them are paid at the minimum wage, or sometimes if there is no minimum wage, even at very low level, at very low wages. It's also a value, meaning a recognition in our society. And I think this is an essential aspect of the way our society finally functions. I always say, well, the person who takes care of my money is well paid and well recognized in society. The person who takes care of my parents or my kids, this work is not really valued and recognized in society, which is finally some kind of basic fundamental contradiction in our society, but also says a lot about how our society functions, because this means that material values, material issues, they are really highly recognized. But if we are with human values, well, this is considered to be a cost, something we have to manage, and by the way, has been managed relatively poorly in the last years in most of the countries, because also these human values in our society, especially those in the care sector, in the hospital sector, in the medical sector, in many other sectors which directly are linked to these essential services. Well, finally, they were also put under the logic of, and you said it already, of a market logic. And they were also put under some constraints, mainly financial constraints. And they were considered as costs and not as investments in the cohesion and resilience of our society. I think this is finally the debate we need in our society now. What kind of society do we want? Do we want a society which is based on this kind of human values, where life is really recognized, where investing in children, where childcare is recognized, where elderly care is recognized, where all the jobs who make our society functioning are fully recognized? And again, it's not just about remuneration, it's also about social recognition, societal recognition. Well, is that the society we want, or just a society which functions on the logic of markets and of financial efficiency? I think this is the debate we need now. Unfortunately, I have the impression that we try to escape this debate. And the pandemic, you know, sometimes the memory, human memory, sometimes is very short. And we talk about the pandemic as something which is far away, though it's not so far away. Maybe it could even come back. So, and this is, I think, the very important issue. And therefore, I think we have to work on different aspects, like working time, like the protection of working conditions of the key workers. I noticed that, for instance, in the hospital sector, very often not only the pandemic made these jobs extremely dangerous, and many nurses and doctors, many of those who were working also in the care, elderly care, were threatened, and many of them died because they got the virus and died of it. But in general terms, the protection also in terms of health and safety protection, finally is not sufficiently developed. We had a very important discussion on health and safety standards, also for healthcare workers, for substances, because they use substances which are supposed to save lives, especially very dangerous substances used in anti-cancer medicine. But these substances very often are also very dangerous for the persons who use them. So I think we have really to promote the working conditions and the health and safety conditions of categories of these workers. Now, on many jobs in the essential or key sectors, talking about working conditions, we see also a new tendency of so-called self-employment. Self-employment is developing because platforms, it's not just about the pizza driver and the Uber driver. It's also about many sectors like cleaning, like care, which is organized on the basis of platforms. And we all know what that means. This means, especially for the platform, high flexibility, which means also no social protection or very low level social protection. And I think this is important. That's why we are so strongly advocating the directive on platform work. It's not just because the poor guy on his bike is bringing the pizza. It's also for these new categories of social workers who are now put into the same situation of working for platforms and having no social protection. Very often, even in some countries, even we have the 0-hour contract where you are engaged, you have a contract, but you never know when you are needed. You are called just when there is a need. You have no security, no salary. You cannot plan your life, and these are the extreme sides of this evolution, especially in those sectors of workers we are considering as essential. So no guarantee, no social protection for those workers that we should consider as essential. And that's why we need a better labor law. We need also, and it was mentioned, certainly the minimum wage directive, important, especially not only because there is the minimum wage directive, the minimum wage there, it's especially for collective bargaining. So it is the need for these sectors to have better collective agreements, to negotiate conditions and salaries which are up to the work they are doing for society. And that's a big challenge. There is now a big issue I want really to mention, and which is really also a danger. I've mentioned the stress, the shortage on our labor market, and especially in these sectors considered to be essential. And there are many others. It's the truck drivers, it's the food processors, and so on. And these are the sectors where we have huge shortages. The solution coming up is, well, we have to organize legal labor immigration. Yes, obviously, we cannot deal with these shortages without legal labor immigration. Very good. The Commission is working now on this issue. Yesterday we had a council meeting where this was discussed also on labor migration. But here, though I'm very in favor of that, obviously, we have to be very cautious because there is also a danger. There is a danger that precisely in all these sectors, especially also care and all the others, truck drivers, I was very much confronted with the issue of truck drivers coming from Uzbekistan, being denied all kinds of rights, being employed as self-employed, without social protection, without health insurance. And the issue is that if we do not guarantee that in these jobs, in these professions, where we need people coming from third countries, mainly developing countries, countries from the south, the standards, the labor standards, the remuneration are going down because the pressure is, well, we can handle these people differently because they are here, they have no choice, and they are treated in a way which is very close to, or not only close, which finally is very equivalent to social dumping. And that's the big danger, because that would mean also that given this situation, what we want to finally change in these sectors will not change, because there is, through these workers, pressure coming from the external side, and labor standards going down. And I think we have, the Commission is working very much on childcare. As you know, we have the child guarantee. We have also a recommendation on childcare. We are working also on the other forms of care, especially care for the elderly. And we always have put together the quality of care and the quality of the care work, because it is an illusion, and we have a lot of examples here, that you can have quality care, but not quality of the work of care, which means that you have bad working conditions in care, you have exploitation of the care workers, you have precariousness in the care work, but you have, for those, the beneficiary of care, good quality of care. This never goes together. And we have good examples recently in France, but there are many others, which show when you are in this marketization of care, well, just oriented towards the financial aspect, because some of these care companies, if I may call them that, providers, if I may call them like that, they are also listed at the stock exchange. So the logic is not what is the quality of care, what are the conditions, working conditions of these care workers. Well, the logic is, where are my stocks? How are my stocks valued? So it's not the value of the care work, it's not the value of the quality of care work for the beneficiaries, it's the value of stock. This is a logic which does not fit together. And I think this is an issue we have to discuss also by coming back to this idea of service of general interest in our society, in our economy, that there are different types of activities. That's why I'm fighting so strongly also for the social economy, because the social economy has not the stock exchange logic. It has a different logic. And this is a logic which applies perfectly well also to what we consider to be the care workers or the essential workers. A last word I would say on domestic workers, because they are probably those who are not defended at all. Well, I know there is a convention by the ILO, not very popular convention, not so many member states, including member states of the European Union, who have ratified this convention for good reasons, for different reasons, not good reasons, for different reasons. But this is also something we have to look at. These domestic workers who do not really appear on any agenda. Now, last word on social partners. Yes, I think social partners have an essential role to play to defend care workers, which means also that care workers or essential workers or key workers have to organize. This is the question of weak social partners mean a weak protection. And weak unions also in these areas mean weak social rights, be it remuneration, but also the protection of or the guarantee of better working conditions. So I think looking ahead also, and given the dangers we are exposed to, and with the experience, how important all this work is in different areas, not only the care work, but also in many other areas, I think we really have to rebuild a bit the values in our society. That should be the lesson of the pandemic. Thank you.
Thank you very much, Commissioner, for those very fitting and heartfelt remarks. I think a lot of people in the room very much shared everything you had to say, judging by how many heads were vigorously nodding along for the past while. So thank you very much for that. We'll now turn to Alicia Holmes, the MEP and Vice Chair of the Employment Committee with the S&D Group. You're very welcome, Alicia.
What, maybe yes. Yeah, no, I'm not that tall. Yeah, no. There you go. That's good. Thank you. I'm not as tall as Commissioner, so I would need it. Well, dear Commissioner, dear Executive Director of Eurofound, dear Director of the ILO office in the EU and the Benelux, dear colleagues and participants. The issue we are discussing here today, this morning, is a decisive topic for the European, of course, Commissioner. Thank you. So I was saying the topic we are discussing today, this morning, is a decisive one for the European Parliament, and in particular for the Employment and Social Affairs Committee, which I'm representing here today. In 2020, we commissioned a study on the re-evaluation of working conditions and wages for essential workers. And we are happy to see that the ILO now calls precisely for the re-evaluation of work of key workers in its report. So let me be really clear on this. In today's post-pandemic recovery context, the Parliament believes that essential workers are the backbone of our communities and key to the functioning of our societies, especially in times of adversity. The essential workers, as nurses caring when we are sick, the farm workers, lorry drivers, and store clerks ensuring our food supply, child minders, refuse collectors, delivery staff, and cleaners, and many others have traditionally been undervalued and underpaid, as other speakers already said, and deserve our recognition. They must be at the center of our attention at EU level and also at EU legislation and policy making. And this is especially true if we consider three of our main challenges we face in this post-COVID recovery context. The first one, I would say, is the deterioration of working conditions and the increase of risk faced by essential frontline workers, particularly women and migrant workers in low-paid occupation. The second one is the disproportionate impact of the pandemic that the pandemic had on specific categories of workers and also sectors, such as feminized work sectors, platform workers, contractual workers, including subcontracted, seasonal and temporary workers, cross-border workers, and workers in the cultural and creative sectors, as well as cleaning, retail, and transport. I think those sectors are quite key, but there are also many other examples. And finally, I would say the health and care workers that have suffered the poorest work conditions during the pandemic, as also confirmed by Eurofound in their latest policy brief. This sector magnifies many of the structural issues we face today, in particular the problem of mental health in the workplace. And today, that is the International Day of Mental Health. I think it's important that we mention that. So in this intervention, I would like first to highlight the means we have to put essential workers at the center of the European Union legislation and policy making, and second, to identify further steps to build on. So in a resolution that we made in January 2021 on COVID-19, the Parliament has urged member states to ensure the full implementation of the European Pillar of Social Rights in their recovery strategies. In particular, the right of workers to fair wages, that is the Principle 6, and the necessity of social dialogue and strong collective bargaining systems, that is the Principle 7. So the resolution also called to address the casualization of labor suffered by women and the feminization of poverty in line with the Charter of Fundamental Rights, specifically the Article 32, as well as to tackle the growing disparity between low-paid and well-paid jobs in the post-pandemic recovery. So as it was mentioned by Commissioner and also by the other speakers, the minimum wage directive adopted last year goes in a similar direction, reinforcing workers' access to minimum wage protection and collective bargaining. And this directive sets a frame for low-paid sectors that have proven to be essential during this crisis, but also maybe coming crisis, of course, and addresses the growing shares of precarious and non-standard forms of work in most of the member states. Now the ball is in the court of member states to ensure proper implementation, and we hope that it will be sooner than later, of course. The durable effect of the pandemic on the healthcare and care sector is a strong warning sign that much remains to be done to ensure fair and decent working conditions for all. We know that women are overrepresented in long-term care services, it's 81%. That labor contracts in the care and domestic sectors are more and more precarious, and that labor shortage in the care sector is endemic in most of the member states. So those facts must alert us to the need to revalorize the care work, the assistance proximity, as well as recognizing the economic and social value care skills in a gender-sensitive way, in line with the Equal Pay Directive. That is also important, and that we adopted in the Parliament this year, and its 2022 resolution that was called Towards a Common European Action on Care. That it's also important to mention. So, in addition, the Parliament has been a stronger supporter of this year of the European Year of Skills, which promotes this upskilling and reskilling that the Commissioner was talking before of all, including socially and economically most vulnerable groups. So the case of the health and care sector is an open window on structural issues that have affected other essential sectors of activity during and also after the pandemic, such as the issue of mental health in the workplace. In the context of the 2022 resolution on mental health in the digital world of work, the Parliament stressed that frontline workers suffered from harassment and violence, both physical and psychological, and recalls that only 60% of member states have a specific legislation to address bullying and violence at work. So in addition, the Parliament called on the Commission to give a special attention to essential and frontline workers in future proposals on improving mental health and well-being in the workplace, and has been calling for further action on this issue, as testified in the resolution on a new EU strategic framework on health and safety at work post-2020. So going to the second point I was saying before, and looking forward, we need a strong budgetary response with target investment schemes and a streamlined access to the EU funds, as well as mandatory social conditionality in public procurement and EU funding in general, capable to answer the pressure on essential services, especially in sectors where recourse to contract and subcontracting make working conditions difficult to monitor. So the regional dimension must be taken into account, as emphasized by the Parliament 2 years after Porto, in the 2 years after Porto Social Summit, which underlined the need to address the national disparities in the access to essential services of good quality, including universal healthcare, accessible education, and decent and affordable housing, as well as we had the opportunity to debate in Strasbourg during the last plenary session. So to close, let me reiterate that further legislative action from the Commission and Member States is required to develop and protect the sectors essential to social and economic activity. What is at stake here is nothing else that the viability of the European social model and its most the fundamental pillars. And at the Employment and Social Affairs Committee, we are convinced that improving working conditions, promoting equal pay, and tackling the gender and mental health issues faced by essential workers must remain high on our agenda. So it's a crucial step in that direction. Will be to translate the growing social awareness and public discourse on essential workers into concrete actions and also rights. So we are looking with anticipation to the EU Social Partners Summits that will take place in 2024 as a unique opportunity to move forward. And we hope that we can work together from the Parliament with ILO, Eurofound, other actors in these sectors, and also with the Commission and Member States, of course. So thank you very much. I hope it has inspired you and hope to keep working together. Thank you.
Thank you very much, Alicia. That'll very much feed into our discussion later on. Again, everybody nodding their heads, so I'm sure you've all got a lot of things that you'd like to bring up. So we'll have now our experts, Janine Berg, Senior Economist with ILO, and Jorge Cabrita, the Research Manager with Eurofound. You're very welcome. Do you want to maybe come up first, Janine? Thank you.
Thank you so much for organizing this event. I really would like to thank the ILO office in Brussels and Eurofound. It's always wonderful to collaborate with Eurofound. We've done a lot of work together on working conditions, and I hope we can keep moving that forward. This is the report that we published back in March. We started it in the summer of 2021 with the objective that Lieve mentioned in her introductory remarks, really to give due recognition to the value of their work, to how they made our societies function throughout the pandemic, but how they make our societies function every day, and also acknowledging all of the shortfalls in their working conditions, and really a call to make the investments both in the sectors and in their working conditions. So let me start with this quote, which I think sums up very well what has happened. So I heard nothing mentioned about truck drivers getting the vaccine. I'm like, wow, we're frontline, front and center. If it wasn't for us, you wouldn't even have the vaccine. So this is from a truck driver in the United States. And I think it really makes clear all of the people who make our societies function. And certainly healthcare workers, we were applauding them. They're absolutely important, but there's so many other people, many of whom are low paid and without sufficient rights and benefits that are important for our societies. So who are the key workers? So to approach the question, what we did was we looked at the lists. There were 126 countries that issued lists of essential sectors at the start of the pandemic. So we took the 2 first months of the pandemic, we compiled these 126 lists of different countries, and then we mapped them. We mapped them to the relevant sectors, and then within the sectors, we looked at the occupations. Now, we excluded teleworkable occupations, not because it's a judgment call that these people aren't essential, but basically because we were concerned about those people who had to really risk their lives, who had to leave the safety of their homes every day to go out and provide these services. So that's why we focused on non-teleworkable occupations. So there was 25 occupational categories at the 2-digit ISCO level. These are the kind of the broad occupational categories, and we compiled them into 8 main groups. So these are food system workers. This is everything from farm all the way to table in our food production. Health workers, retail workers who are providing essential goods, in selling essential goods, security workers, manual workers, again, in the production of essential goods, cleaning and sanitation workers, transport workers, and technicians and clerical workers. So, for example, postal delivery people. Let me just give you some statistics. So our analysis is based on data from, we had 90 labor force surveys that labor force surveys from 90 countries that we were able to use. And we also had interviews with 500 workers, mainly from the Global South. And then we, of course, incorporated a lot of secondary information. But this data is from the 90 countries. So breaking it down between countries at different country income groups, levels of development, if you look at high income countries and you exclude agriculture, it's basically 1/3 of workers are key workers, as we call them. There's a very large percentage of key workers in low-income countries, mainly because these are agricultural societies. So the more diversified your economy is, the fewer key workers you're going to have. And then if we look at the distribution within the 8 occupational groups, here I put up the data by region. If you see Europe and Central Asia, so about 20% involved in food systems, and then we have a very important percentage, 15% in healthcare. In high-income countries, it's 20%, so a very important share of the population in healthcare. In comparison, in low-income countries, I don't have this figure here, but only 2% are in healthcare. So it really just shows you also the underinvestment in healthcare in low-income countries, which was a real concern for these countries. Then many workers, 18% in Europe, involved in retail sector. Another important segment in Europe and Central Asia is manual, so production work. The sex of occupational workers. So many people thought that essential key workers are women, and of course this is really true in the healthcare sector and also in the retail sector. But of course there's also some occupations that are male dominated, particularly security and transport. So globally, 97% of workers are male in the transport sector. So we have a chapter 2 is about really the risk and strain of working during the pandemic. And we picked this picture, this is from the New York City Metropolitan Transport Authority. They have this really nice artwork that they did in honor of all of their workers who died. So this is a piece of their artwork. And the reason that we picked the artwork, not just because of the artistic benefit of it, because we also did an analysis and we also looked at secondary data to see really what were the occupations that had the highest fatality rates. And what we found, so this here is data from the United States and Brazil, where we actually have occupational death rate. A lot of countries have that information, they don't publicize it. The UK also has it as well, and the UK studies confirm this. And what we find overwhelmingly is that transport workers had the highest fatality rates. So there were a lot of deaths in healthcare, but it wasn't as high. And of course, critical workers key workers compared to non-key workers, much higher mortality rates. So it just really also goes to show that you have certain occupations that don't have as much health and safety protocols put in place, that maybe people are self-employed, they aren't sufficiently trained in health and safety matters, they don't have the protections. In healthcare, people are a little bit, particularly in organized healthcare settings, they're a little bit more aware and there's more protections in place. Nonetheless, of course, it's still a high-risk occupation. Another important issue is really what Eurofound has called adverse social behavior. This is data here from Eurofound that George will probably talk about. We also ran a question, though, on the American Life panel to look at the amount of verbal abuse and threats. This is key versus non-key workers, and in both Europe and the United States, this went up. So this confirms a lot of the newspaper accounts that you hear about of people really being harassed and threatened, and all of the abuse that front-facing workers felt during the pandemic. And since it's World Mental Health Day, I think it's important to bring attention to this issue. So what are the deficiencies in working conditions? I'm not going to go through all of them, but the first one is really elevated OSH risk. So certainly there's the biological risks that the healthcare sector faces, but also there's risks, particularly among transport workers, not only accidents, but also long periods of time sitting. All of these lead to cardiovascular problems. Long and irregular working hours is particularly true also in the transport sector, but it's also true in retail and many of the other sectors that we're looking at. An over-reliance on temporary contracts. 1/3 of key workers from our 90 countries are working on temporary contracts. A lot of this is in agriculture, but this is also true in many other sectors. Low pay, and I'll give you some statistics on that in a second. Underrepresentation, especially in a few key sectors. This is mainly retail. There's very little representation in the retail sector, little representation in some of the agricultural sectors and food service sectors, higher in healthcare, but still deficiencies in many parts of the world, particularly outside of Europe, where we really have low representation. Deficits in social protection, including paid sick leave. I mean, here we have this irony that you actually had workers who were front-facing, and in many countries in the world, they were without paid sick leave and insufficient training. So let me just give you data here on low pay. So low pay is defined as people who earn less than 1/3 of the median wage. And if we just analyze key employees versus non-key employees, so this doesn't include the self-employed, this is just wage workers. You see, if you look at high-income countries, such as many of the countries in Europe, 19% of key employees are low paid compared with 13% of non-key workers. And in every region, at every income level of the world, you see this imbalance between key and non-key workers. We also did an analysis, what we called the key worker wage gap, basically looking at what explains some of the shortfalls in their pay. So to what extent is explained by human capital determinants and what part is unexplained. So on average, we find that key employees earn 26% less than other employees, of which only 17% of this is accounted for by education and experience. So there's another 9 percentage points that's unaccounted for. So this substantial pay gap, we really feel it exemplifies this lack of valuation of key work. So turning now to the policy recommendations, as we've mentioned, I mean, we really make a call for not just investing in working conditions, but investing in the sector. So you can have beautiful laws on the ground, but if you're working in a hospital that is underfunded, you're going to be understaffed. And of course, if you're understaffed, then you're going to be working longer hours. You're going to be facing adverse social behavior from people's families. So all of these things ricochet onto another. So there's really importance about making a call really for investment. And this is particularly true in low-income countries, which are saddled with debt, which do not have enough money to invest in their healthcare sectors and other key sectors. But it's true in every part of the world, really. But I want to just turn to the working conditions, since that's the focus for today. So the first one's really about safe and healthy working places for all. As many of you might know, the occupational safety and health has now become a fundamental right in the ILO since 2021. So this is a really important step forward in world recognition of the importance of occupational safety and health, and it's something that we really need to call for, particularly for workers who aren't in an employment relation, the self-employed. There really needs to be some sort of accountability so that all workers get the protection that they need at the workplace. Equality of treatment, this is really the principle that regardless of what your employment contract is, that you can have the same rights and benefits, in the sense that if you're a part-time worker versus a full-time worker, you have access to the same rights and benefits. Obviously, your benefits would be pro rata, but you would have access to the same rights. This is something that's stronger in the EU because of the directive, but it's less strong in other parts of the world. Safe and predictable working hours. Too many people are working on-call arrangements, or the platformization, the Uberization of the labor market. We're seeing people really an increase in irregular hours. And of course, we have very long hours in some sectors such as transport, so far more than anything that's recommended in terms of safety and health at the workplace. We need wage policies that support the valuation of key work. So really the importance of not just minimum wage, but of course, a collective bargaining, and really to make steps forward to give them the valuation that they need. Extending social protection so that all workers can have basic social protection rights, and particularly in the report, we give special attention to paid sick leave. Training, the importance of training. All workers want to have career development. All of that is really important, and it's particularly important to have training in occupational safety and health issues, which is something that's lacking. And then, of course, we need to be turning laws into practice. So the importance of compliance and enforcement. Too many countries across the world have very beautiful laws, but on the ground, nothing is actually put into place. So I just wanted to give one example on the issue of skills valuation. So in New Zealand, there was actually a case, and this was before the pandemic arrived, and that was brought forward. It was a nurse that sued, brought a case forward to the Employment Court of New Zealand, arguing that there was systematic undervaluation of care. Because this was in a government-run sector, the government settled with the trade unions out of court, and they passed an act in June 2017 that was the Care and Support Worker Pay Equity Act. And as a result of this, care workers received increases of 15 and 50% depending on their qualifications and experience. And so often what you see in feminized sectors is that regardless of the same skill levels, there is an undervaluation. Again, this, this theme of a lack of appreciation for certain occupations. We find also in some of the economic literature that social skills, if somebody is a manager and they have social skills, they actually get bonus in terms of pay if they have those skills. But if you're in the lower wage if you're at the lower part of the wage spectrum, you're actually penalized for having social skills. So there really needs to be a rethinking of this. And I'll just end there. Thank you very much.
George, thank you very much. George Cabrita, you're a research manager at Eurofound. Very welcome.
Thank you so much. Now, I think I'll do like the commissioner and I'll get rid of the little step here. Thank you very much. Good morning, everyone. It's a big pleasure to be here today to talk a little bit about the research which is just out today in this publication policy brief on job quality of COVID-19 pandemic critical workers. I'm not going to get into the discussion about critical or essential. We'll skip that part. But of course, we were confronted with the same type of problematic, which is which term to choose. And at some point, because there's still an ongoing debate, we decided to go with critical for the very simple reason that there are some official guidelines which have been issued by the Commission, which refer to critical occupations. So we decided to stick to that term and we took it from there. So what is important here for you to know from the beginning is then when I'm talking about critical workers, this means that I'm talking about workers in so-called critical occupations and in critical sectors. So it's the intersection of those two that we are looking at here. And to get to those lists of critical occupations and sectors, we have consulted our network of national correspondents, experts at national level in all the member states, and we collected information like the ILO did on lists of so-called essential workers or essential sectors. So we brought all that information together, we mapped it out, and we tried to have a harmonized but comprehensive list of occupations and sectors that would allow us to have some sort of workable classification. And this is the, so if we take that approach into consideration and using one of our, let's say, best sources of data on working conditions, which is the European Working Conditions Telephone Survey that was carried out in 2021, we can say that 45% of the European Union workforce in 2021 could be considered as critical, okay, 45%. This share changes, it's kind of different from member state to member state. It varies from 38% in some countries, in Cyprus, for instance. In other countries, like Luxembourg, for example, it's above 50%. But there's a kind of a range there. Overall, in the European Union, we are talking about 45%. And because we would need also kind of workable and meaningful groups of workers, because they are not all the same. There are different kinds of workers within this group. We identified 11 different groups, okay? And this includes the usual suspects. So here we have mentioned already several of these groups: health and care workers. We talked about the cleaners and refuse workers, transport workers, manual workers, food system workers, also education workers. But then we also felt the need to mention some office workers, but also scientists and engineers. There were many of them working during the pandemic as well, very hard to try to find solutions to fight the pandemic. Protective services workers, ICT workers, and also managers and legislators. Some of them were also working very hard. So we did not exclude teleworkable jobs like the ILO did, so therefore the share is slightly larger, I would argue. This is again the issue of gender distribution. So Janine already mentioned this, but it's just to draw your attention to the fact that all of these groups have different distributions of men and women. So on the left-hand side, you have female-dominated critical groups. So we have here the health and care workers and education workers. On the right-hand side, you have the transport workers, protective services, scientists, ICT workers, manual workers, which are heavily dominated by men. Okay, so when we talk about these different groups, we are talking about different kinds of compositions. This is just one of them. There are many other characterization elements in the different groups, and you can have a look at those in more detail in our report. Nevertheless, gender is an important one because, as you can see here, the impact of the pandemic during the pandemic and for the future will be different for men and for women, and this is really crucial. Then, what I would like to highlight is some of our findings in relation to two main elements. The first one is job quality. And when we are talking about job quality at Eurofound, we use this framework of analysis, which is based on the idea that work is composed of two sides, if you wish. We are talking about job demands on one hand. So we're talking about physical risks, physical demands, job insecurity, work intensity, intimidation and discrimination, which includes the adversarial social behavior that Janine mentioned, but also unsocial working hours. So these are the elements of our work, of our jobs, which take effort from us, okay? They take energy from us. So if you wish, they have a negative relationship to our health and well-being, okay? So the more of these things, the worse will be our health and well-being because of work. But then this is on the other side of our scales there, we have the so-called job resources. And these are those aspects of our jobs that gives us the support and the tools needed to do perform a good job, and also to some extent to reduce the impacts of the job demands. So here we have career advancement, training and learning. So we talked about skills a lot. The commissioner mentioned that several times here. Task autonomy, social support, intrinsic rewards, self-realization, participation and voice, flexible working hours. So these are the elements that you can have a look here. But this is all treated in very great detail in our policy brief. I'm not going to go in detail. What I'm going to show you is a chart which condenses this in such a way that shows us the shares of workers which have more resources than demands in their jobs. And those are the green bars on the right-hand side. So those are those workers that actually declare that their job resources surpass to some extent the job demands of their jobs. On the left-hand side, we have it's called usually strained jobs. So those are the workers for which the job demands are overweighing their the job resources at their disposal. And what is important to note here, first of all, is that 30% of the whole workforce, which is their EU27, 30% of workers in the European Union can be considered to be in strained jobs, okay? And that's quite significant. But then, as you can see here towards the bottom, there are 6 of our 11 groups of essential workers which have a larger share of workers in strained jobs. And at the bottom, we have our health and care workers, for which 50% of their total are in strained jobs. This means that these workers are subject to an excess of job demands vis-à-vis the job resources that they have at their disposal for their work, and this is very likely to have a negative impact on their health. So this is, in one very simple image, the situation of our critical workers in Europe. So above we have some situations which are kind of okay, a bit better than the European average. We can look at it, but at the bottom here we can see our cleaners, our transport workers, food system workers, manual workers, protective service workers, actually in a dire situation there. And job quality is important as well for another element I would like to talk about, which is sustainable work. So sustainable work is this idea that it's the relationship or the conditions under which living conditions and working conditions are such that people are able and willing to engage in work and to continue to be engaged for long periods of time. And this is defined by a number of aspects, and I would like to draw your attention to 3 of them, which we talk about in our report. The first of which being related to pay, but it's not strict pay. This is about economic hardship, and we know, and it's been well documented, that difficulty in making ends meet, it's a very good indicator of economic hardship. The good news is that many of our groups are better than the European average, but the bad news is that, as you can see at the top there, we have cleaners and refuse workers, food system workers, transport workers, and manual workers reporting that they have difficulty in paying their expenses at the end of the month. Okay, so this is a reflection as well of low pay and difficulties in and having a relatively poor pay in their jobs. The second aspect of sustainable work is employee representation. Several times here this morning already we heard about this issue, right? So employee representation is actually a worker's right. They have the right to contact a union or an employee representative to negotiate on their behalf their working conditions, including pay and other working conditions. And what we have in this chart here is the shares of workers reporting lack of employee representation at the workplace. Again, we have some good news here. Many of our groups are better than the European average, but at the top, we have food system workers, transport workers, and cleaners and refuse workers with large shares and much larger than the European Union average shares of workers without any, employees. These are employees without representation at the workplace. Then another aspect as well, and Ivailo here mentioned this morning, and the Commissioner Schmit as well, the importance of health and safety at work. We ask in our working conditions survey to what extent people feel that their health and safety is at risk because of work, and these are the shares. And as you can see here, most of our groups are have large shares of workers reporting this impact. Okay, they say that their health and safety is at risk because of their work. And at the top, we have our protective services workers and followed by health and care workers. So these are, and also transport workers there. We are talking about more than half of these groups reporting this kind of impact. So if we think in terms of sustainability, this is something that we want to try to avoid. And as you can see, there are massive amounts of workers reporting this kind of impact. Then I'm nearly reaching the end. It's just to say that at some point we had the privilege to interview some social partners representatives. Some of them are here with us today. They will be sitting on the panel to discuss a little bit further. And in this table, we synthesize some of the main challenges that they identified for their sectors, which are taking place at the moment, and they will be important for the next few years. You can read this in more detail in the report. What I would like to draw your attention to here is something that has been repeated here several times, which is labor shortages and attractiveness of jobs. Actually, lack of attractiveness of some jobs, which in a way it's the other side of the same coin. In every single one of the sectors that we interviewed, at least one of the sides of the industry reported that this was an issue. Most of the times it's because of poor working conditions, so the cause is well identified, but it's certainly something which permeates some of our so-called essential sectors. So just to conclude, and then I'll be happy to reply to any questions and to engage a little bit in further discussion. The first thing we would like to convey to you is that the European Union capacity to deal with future crises is highly dependent on the job quality of our essential workers. Okay, so if we want to go through the 3D transition, the demographic transition, the digital and the decarbonization transition, we have to ensure that our workers have a decent job quality. That's crucial for the future of the European Union. Then the second issue is, of course, labor shortages. And for us, and from what we see in our research, what we would argue is that one of the elements to deal with labor shortages is to improve job quality. If you make jobs more attractive by improving job quality of these jobs, that's part of our equation, isn't it? It's not easy, but it's should be part of our talks. It's not just pay. There's more than that. So how do we improve job quality? I mean, the formula is it's relatively simple. You decrease your job demands and you increase your job resources. We talked about investment here this morning several times, right? So social investment, public investment, and so on. that's actually part of the conversation. How can we improve our job resources at the workplace level? And some of these things are even, they have almost no cost. Like social support, getting support from your colleagues or from your managers, that's something that doesn't cost much, right? So, so if you want to talk about improving job quality, this is a simple formula, and I'm sure social partners will have plenty of ideas on how to do this in concrete terms. Finally, sustainable work practices, we need that. And we heard here several times, and I would reinforce that idea as well, fair pay for these workers, for all workers. Fair pay in accordance to the value they provide to our societies. That's one of the crucial elements, starting point, but then we also need to promote representation for all, to ensure that there are mechanisms and support to ensure that every single worker can find someone that represents them for any negotiations needed regarding their working conditions. Final point, public investment in working conditions to reduce the impact on workers' health of the work that they do. If we improve our working conditions, this will be certainly achieved. So I'll stop here. The last slide is the cover of our policy brief. It's not out soon, it's out now. So if you go to Eurofound's website, you'll find it's the very first thing that you see on our website. Thanks so much.
Thank you, George, for that. I think that was a great segue into our panel discussion. I hope you can take part in the discussion, in the debate that we're about to have. The panel is entitled "The Role of Social Dialogue in Ensuring Decent Work and Job Quality for Essential Workers, Key Workers," and so on. So each speaker will have an introductory, give a little introductory remark, maybe keep it to like 4 or 5 minutes if that's okay. And then we really will welcome your engagement and your comments and questions and so on. So I'd like to invite up to the stage Marta Branca, Secretary General of the European Hospital and Healthcare Employers Association. Adam Rogalvelski, Policy Officer at the Health and Social Services European Federation Public Service Union. Matteo Matarezzo, Director General, European Cleaning and Facility Services Industry. And Mark Bergfeld, Director of Property Services at UNI Global Union. Thank you very much. Marta, I might give you the floor first if you want to maybe give your remarks. Thank you so much.
Dear colleagues, thank you for inviting me to speak. Thank you for picking up the topic of essential workers. For us as social partners, it's crucial work together to ensure that our sector become more resilient so that we can provide quality care to patients. OSPIM is the European Hospital and Healthcare Employers Association. Our members are independent health employers organization with the powers to negotiate on pay and on terms and conditions of service with their respective trade union partners. The OSPIM membership includes public hospitals, private hospitals, private not-for-profit entities, and hospital larger organizations or federations. Since 2006, OSPIM is recognized as a European social partner representing the employers in the sectoral social dialogue for hospital and healthcare. Social dialogue includes negotiations, consultations, joint actions, discussions and information sharing involving employers and workers. We think that a well-functioning social dialogue is a key tool in shaping working conditions involving a variety of actors at various levels. It balances interests between workers and employers and contributes both to economic competitiveness and social cohesion. The policy brief outlines different job demands and job resources, as we have listened, that the Sectoral Social Dialogue Committee has been discussing and working up in the past years. Having said that, we should underline that already before the pandemic, the health sector has been facing major challenges that are complex and multifaceted. They come from the combined effect of different societal and economic factors, such as an aging workforce, and a lower amount of new recruits that lead to shortages of health professionals, retention issues in a number of health occupations due to demanding working conditions, limited career prospects, and in such cases, non-competitive remuneration. In our sector, in the health sector, there is increased use of new technologies. There is a development of new care patterns and a rising number of elderly patients and patients with chronic diseases, multimorbidity, obesity, and mental illnesses. And all this requires new skills and a need for continuous training and updating of the workforce. So in this context, patients' demands and expectation for high quality care, a greater involvement in decision making relating to the healthcare services provided, and a greater emphasis on preventive care are growing a lot. Through the European Sectoral Social Dialogue, we ensure that our views, means workers and employers, are properly taken into account by the EU institutions. We're launching policies that have a direct impact on labor relations and management in the hospital and healthcare sector at European and national level. As OSPIM, we keep underlining how the hospital and healthcare sector is fundamental to the well-functioning of the economy and society. And so it's not just a cost, but it's a worthwhile investment that needs to be regularly made. And the awareness of this essential character was well in the public eye, as somebody has already said, during the COVID pandemic. And I am convinced that this attention needs to stay on to ensure a good level of regular investment into our sector. And this policy brief contribute to that, which is why I want to thank you again for this. And we believe that in this complex and continuing evolving scenario, social dialogue has truly a crucial role, because it allows for a constructive and creative discussion that goes beyond the simple trade union demands and employers' responses. The activities that we carry out with EPSU concerns various thematic areas such as recruitment, retention, musculoskeletal disorders and psychological risk at work, preventing third-party violence, aging workforce, continuous professional development and lifelong learning, just to name a few. As we can see, these are crucial issues which often represent serious problems, but faced with a collaborative spirit, without being stopped by different points of view, but enhancing the aspects that can be shared by both parties. Our sector is crucial for the well-being of the society we live in and the economy we contribute to. Together, we have enabled society and economy to get through the pandemic in the past years. We have shown adaptability and resilience. As I said, it's not a secret that the health sector is in a challenging situation. Member states need to understand that the health sector is a worth investment for the well-being of society and economy, and that need to invest further into our sector. Thank you.
Adam.
Yes, I think I'm also quite tall, so.
Oh yeah, you.
So first of all, I would like to, I'm Adam Ogaleski from the European Federation of Public Service Unions, which was already mentioned by Marta Branca here. And I'm in such a very good position now that what I wanted to say here is just only echo what Marta said, because as you know, in our sector social dialogue, when we represent healthcare workforce, we are speaking the same voice. And this actually means how important is cooperation between the trade unions and employees. And I think we're running out of time, so I just maybe, Marta already said what is the core message of us in the healthcare sector, but maybe even though to make this 2 minutes presentations, I would like to first of all thank you Eurofound and also ILO for organizing this very important seminar and for the research. And in terms of discussion whether they're key or essential workers, we with Marta Branca are in a very good position because of course health and social care workers are essential workers. So this is those people who are at the front line of the pandemic, and without them we won't be able to survive. And what I want to also mention here is as you could really see at the Eurofound report saying about what is our biggest issues of the trade unions and employers, like Jorge was presenting, is actually the same. So we are speaking really the same voice. Our biggest issue is, of course, staff shortages. Marta Branca was already mentioned this, and when we talk to the healthcare assistants or the nurse, the issue if you ask them will be staff shortages. And staff shortages are also not related to staff shortage as such, but they cause a lot of occupational health and safety problem, starting from mental health, continuing with musculoskeletal disorders, which are very much related to that, and maybe finalizing with the third-party violence, because what you could see in the hospital sector, when there is not enough personnel, then, if you are a care recipient, you are going to the hospital and saying what's happening. So that's an issue that were arised during the COVID pandemic. Secondly, we know that we talk about staff shortages, and already Commissioner Schmit was mentioning this. We already have 2 million workers missing in the sectors. We need to recruit them. We are so desperate in these situations because we know that not only the future of our societies depends on the staffing levels in the sector, because if the society is getting older, so we need to know more healthcare professionals and social cares. But we somehow not learn the lessons from the pandemic. And this is actually, Commissioner was saying, we have this timing of, applause for the healthcare workers, and now it's stopped. Now we have a war in Ukraine, which is of course, justified situation. Now we have a cost of living crisis, and what we really observe is that the discussion on improving the healthcare sector is sort of like not there. And Marta was really right to saying, we need to, after the COVID pandemic, change this narration. This is not cost, this is an investment, and we need to do it. We need to do it for our future generation, but we need to do it. in order to address staff shortages. And it's not only pay, as was already mentioned by Eurofound. It's about the general working condition. It's about the protection from third-party violence. It's about ensuring that workers have access to qualification and skills, because that's important. But it's also ensuring the work-life balance. And then I really want to underline the important issues. That's the healthcare sector is the sector with majority of women, no? So that the gender issue is there. And I think when you really look at the sectors which are essential but not well recognized, this is because there is a lot of women there. And I'm still thinking about the nurses going on strike in the UK and other countries. And with all respect to colleagues from metal industry, automotive industry, there will be issues there, no? So I think we really need to underline the issue of the gender in the sector. And that is actually moving us to the situation of work-life balance. We need to really try to discuss this, and we're already discussing this with Marta Branca in terms of framework of actions, recruitment and retention. So it's not only the pay. And so to finalize my short presentations here, again, this is a very good meeting because we are all speaking the same voice, starting from the researcher, from ILO, Eurofound, from the commissioner. So we survived the COVID pandemic. We know that collective bargaining is important. We know that social partners are important. But we need to maybe leaving this meeting in a message on the national level, on the European level, that we are crucial here. So we are really experts in terms of our sectors. We as a trade unions and employers organizations, so trade unions need to have a strong employers organizations in order to negotiate and bargain. And employers need to have a trade unions, because as the COVID pandemic showed, that the best solutions were when the employers and trade unions were sitting together and discussing how we could provide the society with help and protect society from the COVID. So that's all from my presentations. And only maybe one thing is here. Colleagues, it's not that COVID pandemic is over. We know there will be a future health emergencies. One of those is actually the antimicrobial resistance that is probably coming very soon because of the antibiotics. So I don't want to meet here again in 5 or 10 years time saying, you know what I mean, we are in the next COVID pandemic and we know about this, that we are having recommendations, nothing happened, because we need to do it. And the last point is about migration, but also probably colleagues from Mark will be saying about that. We need to really ensure, and this is what we are doing with Housekeeping, that we need to protect the migrant workers from exploitations, right? So that's the most important thing. And I'm really looking forward to a discussion with you. Thank you very much.
Matteo, do you want the chair, or do you want to sit there, or do you want the? Yeah, that's better.
Is it on? Yeah. You just witnessed, without knowing it, social dialogue in action, because Mark and I, our partner, and social dialogue just agreed that we would sit. So an agreement was stricken, and it was a very effective one because we are both sitting.
We didn't negotiate.
Exactly. That's the wonders of social dialogue. You take the decisions there where you need to take them, and the people who knows best take those decisions. But joke apart, my name is Matteo Matarazzo, and I'm representing FC, the industry, the European Employers Association for the Industrial Cleaning. We represent approximately 300,000 companies of all dimensions, even though we'll see later that we're mainly SMEs driven, and we employ approximately 4 million workers in Europe. And I would like to start first by thanking the organizers, thanking ILO and Eurofound, because you always provide us with food for thought, and you really give us the possibility of knowing more about the things we're discussing. You have provided, I've studied, I've looked at the report, the Eurofound report, very in detail, and I've found out things that I wasn't really expecting to know about my sector and the industry we represent. So thank you very much for the great work you do to help policy making progress. The people we represent, the workers and the employers, were those who basically created the conditions for society to gather, to feel safe, for each of us to feel safe about going back to hotels, going back to pools, taking the public transportation, going to the supermarket. We create the conditions for people to trust the others again. And this is, I think, we are all critical here. We're all essential, but building trust and keeping trust alive, human trust, I would say, was probably the foundation for society to start the machine again, in a way. And of course, there's nobody here who's more important than the others, but differently, probably from the other categories of essential workers, we suffer the most from invisibility. Our people work when the others don't. You very rarely see our people work because they usually start working at rather late at night or very early at morning. And when you join, I mean, actually, the best work we do is the work you don't notice, because you all give for granted that your offices are clean, that the toilets you're using are clean, so you don't really notice when it works. So we had to go through, and I'm sure Mark will confirm this, we had to go through, and in one aspect, COVID was for us a good opportunity to gain invisibility, to become visible, to make people aware of the existence of our people, of our companies, and the efforts that they were doing to keep the economy and the society afloat. If I look at and this is, I mean, the dimension of visibility is extremely important for our sector. I was very happy to read in the report of Eurofound that apparently our category rates the best for the what I think you call them implicit rewards. So the positive aspect of working, that is recognition and feeling rewarded for what they do. It's amazing to see that the people who were interviewed still had this capacity of feeling and being perceiving themselves as so rewarded in their work, despite the very visibility that they were enjoying, the very little visibility that they were enjoying on the workplace. Of course, you were explaining to us it's about job demands as well, and our sector is also, I mean, if we look at the three slides that Jorge, you were showing, we don't probably rank the best in the three of them, but it's also very dependent on the specificity of our sector. I was saying before, figures are always very important. Out of the approximately 330,000 companies that are operating in the cleaning sector, around 300,000 have less than 10 employees. They are very small SMEs. And this is, and in a sector where the cost of labor is by far the highest cost of our industry. We cover approximately, depending on the country and the sector, 80% of our costs are labor related. So, and we have been specifically in this context of high inflation, we have been having to follow up on the various labor cost increases that have been discussed at national level, and we have been there providing through collective bargaining our response to this change. When it comes also to working conditions, it is probably true that it's also a fact. We are extremely dependent on the conditions that are set on us by our customers, by our clients, and we have the specificity that we are extremely dependent among the customers on public clients. 50%, almost 50%, in some countries, 50% of our turnover is public authorities, is contracting agencies from at national, local government level, and we have a significant issue there in terms of the rules for public procurement, because this is what our the sustainability and the viability, the financial viability of our industry also very much depends on, and we have a dimension there that we need to look into, and this is also part of our discussion within the social dialogue debate that we have with Union Europa. But if I have to look at the very title of this panel and the importance of social dialogue, I can only once again, I mean, it's good to see that we all agree on the same points, that we are, because we are the recognized social partners and we make social dialogue a reality. We are those who, better than anyone else, are in the position to decide what's best for the people we represent, for the two sides of the industry. And Adam, you were saying it. Sorry, no, it was Marta saying it earlier. It's not really about, but you could have said it as well. It's not about defending the interest of the unions, or it's not about defending the interests of the employers, because we both need mutually each other. Without a strong, organized and present union movement, we are not in a capacity of having a credible representative to discuss the things that matter the most, and vice versa for the unions. Without credible employer associations that are recognized, such discussion cannot take place. And in an industry like ours, where the importance, the weight of labor costs is so high, it's simply unthinkable of looking at the way we do our work in a way that is not respectful and aiming at advancing the conditions of the people who work for us. I think this is probably a good introduction, and I look forward for discussions and other questions. Thank you.
I'm just going to set my timer so I don't go over. So I think what it would be good to do is to kind of zoom back of how our societies have been realigned and reconstituted during the COVID-19 crisis along 4 axes. I think what we have seen is, economically speaking, post-pandemic, is that corporate power has reasserted itself to an unprecedented extent. If you look at the way that we see a seller's inflation, which has been proven by economist Isabella Weber, for example, it's a distant cry from what we saw during the pandemic, where we were celebrating essential workers. If we look at the political situation at the moment, we see that governments, whether they're liberal, social democratic, conservative, etc., are actually attacking political rights. We see it here in Belgium, we see it across the board in Greece, one of the EU countries, where the Press Freedom Index shows very clearly attacks on political and civil liberties. And I think that that's something to bear in mind while I talk. Then the other thing that we have spoken about, and I will pick up on as well, is the kind of visibility that we have seen for essential workers, which was really a socio-cultural moment that we haven't witnessed in the post-World War II history as such. And I think it's an important one going forward for us involved in industrial relations. And lastly, and I think this is the most shocking aspect of the kind of cultural moment we are in, and which has grave consequences for our industrial relations systems, is the deinstitutionalization of that we witness across society. People are no longer consuming like public news broadcasts. They just get their news via Telegram chats. People no longer want to join trade unions because I don't want to be part of a collective. People don't want to go to church or synagogue anymore, and were unable to do so during the COVID-19 pandemic because they effectively, we were practicing social distancing. And we see that cultural change across a number of different ways, and I'll get into that. So what does that mean all for cleaners, these kind of realignment or these kinds of axes? I think what we have seen in the reports by Eurofound, but also by the ILO, is that cleaners continue to work in the shadows. And Professor Jana Costa, who has published a recent book on the cleaning industry with Cambridge University Press, calls it working in the minus, because they're not visible. They're often subject to sexual harassment. We see that the main client premises that they're working on is not actually their employer. So there's also no identification with the employer per se. we see that through the working arrangement of working during the night, working in the early hours of the morning, not being able to put your children to bed, not being able to take them to school, not being able to participate in union meetings, in political events, etc., we see a further divergence between those middle and high earning income groups on the one hand, who can lobby, who can advocate for their political demands, and low wage immigrant workforce, often disenfranchised workers working in those conditions. And that is mirrored by exactly what the Eurofound research says, that union representation is below average within the cleaning sector. And if we were to look at whether the political propositions of cleaners were to actually be reflected in parliamentary debates, we would see that that is not the case. So it's actually no surprise that we're dealing with labor shortages in the cleaning sector. It's no surprise that we're dealing with labor shortages in the security sector. Why would you want that your child becomes a cleaner or a security guard, or even I was talking to Marta Branca about hospital workers, about a hospital worker, if you know that that is the situation that your child will face in the future? And if we look about how people in the past have chosen their occupations and jobs, it was precisely through generational linkages, right? Your father was a handyman or a tradesperson of a certain kind, you became a tradesperson. My great-grandfather was a steel worker, so my grandfather was a steel worker. My dad broke that chain, in the 1968 generation, but we see that that chain is really being broken. So I think it's important to discuss then what essential actually means. And I think essential, and it was pinpointed to in the previous discussion, is a 5 minutes, that was okay. So what I'll end with then, and we can talk about social dialogue because I have a whole section on that, but essential I think is contested, because I think what we're seeing is, we're not only seeing it, we're seeing different laws being put into place at the moment, whether I just returned from Italy on the weekend, where essenziali is being used to undermine collective bargaining, where it is being used to effectively undermine the right to strike for workers. And at the same time, we're seeing that essential workers, they might have been people might have stood on their balconies, but it effectively has become a double-edged sword, in the sense that you're more visible, you have been incorporated into different social protection systems, like SURE, Recovery and Resilience Fund, through the CARE strategy, through the Directive on Adequate Minimum Wages, at that institutional level, but we don't see an organizational realignment where the balance of power between workers and employers is being addressed. And I think that is the crucial point if we think about what social dialogue needs to do in the future. It is precisely working on that, addressing that power imbalance that we have witnessed, not only during COVID, but since the 1990s. We see stagnant wages, we see people on more and more flexible contracts, etc. And I think we see an immigrant workforce which is being deprived of citizenship in many EU countries. And so I think that that is some of the key aspects that social dialogue really needs to address. And I'm working on it with my counterparts on the employers, and maybe we can talk in the discussion about how that looks concretely.
Thank you, Mark. Donna? Wait, sorry, I should know how to do this. Okay, thank you. And we will have a panel discussion, so I hope everybody, I'm sure you've got lots of things to say. I was just going to ask you, Mark, something that you made an interesting point, because you said that the corporate power is reasserting itself, which is interesting because at the same time, obviously, you also talked about how the standards and quality of jobs is actually reducing. But how is it? Because there's a sort of a conventional wisdom that people have now the ability to reassert themselves and to negotiate better contracts because of the major labor shortages that we've heard about all throughout the day. So why is it that there's still no ability for people to negotiate better job quality?
Okay, so a quick lesson in labor economics broken down. It's the crux of the difficult puzzle we have at the moment as trade unions. So first and foremost, I would say that we have a situation in which the labor shortages across the different sectors effectively end up with people not opting to join unions in the majority of cases, and then try to collectively organize, use their collective power, and then assert themselves vis-a-vis the employer. But because we have a sectoral divergence within our economy, where in some sectors, wages are developing much quicker and much faster than in other sectors, given their financing structures through venture capital, private equity, etc. What we see is it's much simpler for a worker to gain a €2 wage rise or even a €1 wage rise by changing the sector rather than actually reasserting themselves vis-a-vis their employer. So that means that in Italy, I speak to cleaners, I spoke to security guards. What are they saying? They're saying, if I end up stacking shelves at Lidl, I earn more than working in the private security sector. If I go and work at Amazon, because Amazon is cash heavy, I can earn much more than effectively mopping floors and pursuing a qualification. And that sectoral divergence is a feat of our contemporary economy, which needs to be rebalanced, because it cannot be the case that we have sectors in our economy which are deemed essential, critical, or key, that effectively are at the whims of the public purse, and we have seen austerity measures like undermining quality service provision. And then we see sectors particularly dominated by US corporations, the Ubers, the Teslas, the Amazons, the Googles, etc., that effectively can start to just take a very different route away from our European social model. And I think that's something that needs to be addressed in order to effectively then have sectoral collective bargaining systems which work, in which employers can't escape and choose the lesser collective agreement, can't circumvent the collective agreement. So even Lidl or Aldi, companies I go and shop at on a day-to-day basis, they have enough cash in the retail sector to pay higher wages than than other supermarket chains, and then other supermarket chains like Deleuze in this country, and we need supermarket workers and retail workers are essential workers, effectively need to franchise their business or put under cost pressure, etc. So I think it's an individual route that is being chosen because it's the route of route of last resistance, rather than the collective one, which is more difficult given the power balances which continue to exist.
And would anyone like to make a comment from everything we've heard today, including from the commissioner, for example, who I think was singing off the same hymn sheet? I mean, he could have been working for ILO or Eurofound, as far as I could read. But is there anybody who would like to make a comment or a question to the panelists? That lady there, just behind in the white. Oh yeah, here you go.
Hello to everybody. Actually, I'm coming from Montenegro. Montenegro is not part of EU, and thank you very much for this opportunity to hear how it looks like in European Union. I had the opportunity to hear that very inspiring speech of Commissioner. I'm glad I had that opportunity, and to hear all of you. And I would like just to add on your question and your last comment. I see that people, they lack willing of fight for their rights. So you said they don't join to European Union. Yes, they have mechanisms. In our country, trade union, I think at one point they become a partners to government. So they were, signing contracts which are not interest of workers, but more government and employers. So at one point that ruined the image of trade unions. I don't know if that is the case in European Union. So maybe you can comment there. So maybe we do need some new kind of I don't know, new strategy for our image. Because in our country, in order to achieve better condition, working condition and better salaries, we had to change strategy. And we do that and succeed. And finally, after 7 years of fighting, we succeed to rise our salaries for 100%. But it was not through collective bargaining, because we didn't have right. And the other trade union who were representative, they were partners of the government. And rising the salaries of 5% was acceptable for them and very good. So we need to be honest from our side and see what are the problems, because people would probably support something which is their best interest for them, yeah? But somewhere we have a trouble, we have a problem. I don't know why. Maybe they don't believe us, or it is something else. It is a just comment. Thank you.
Thank you. That was great. And this lady here, the pink, was looking to.
Sorry, Anna Kwiatkowicz, Business Europe. Sorry for the pink, but I'm Viking, so just.
I think it's white.
But anyway, I would like to bring the discussion back to the European Union circle, and thank you very much for pointing out the importance of strong social partners. This is also the key for us, and this is why Business Europe and ETUC will always support any initiatives at different levels to support the capacity of social partners, both cross-industry level and sectoral. We are very grateful to Eurofund for all the research work that supports our work, but also for the Commission programs. And just to mention that 3 countries last year, within the framework of European semester, were granted special funds for supporting capacity building of social partners. These are the countries where social dialogue is the most challenged or has more room for improvement. So this is something that I think we need to remember. And in the discussion of essential workers and condition of work, thank you very much, Jorge, for this job demands and resources. I think it's very important, because what I appreciate a lot is that you also zoomed on not only on financial aspects of rewarding workers, but also on non-financial. I think it's very important in the context of the sectors that we discuss, because pay apart, the image of the sector, attractiveness, promotion or career developments clearly is an issue. And maybe when I listen to you, Matteo, I thought that maybe this is something that we can put more in discuss a little bit more, because apparently in your sector people feel rewarded or appreciated. So that was very, very interesting. Thank you very much.
Thank you very much. We might just leave those 2 and then come to the panel, and then we'll go back and get some more people. But maybe who would like to take the first point from that lady there? That maybe people aren't, Mark, you talked about it earlier, that people aren't joining unions anymore, and maybe it's because people don't feel that the unions are representing them in the way they should, that they're too close to the government parties. Is that any of your experience, or is that an awkward question? You take it there, Adam.
Can I take it, because I'm originally from Poland, so maybe that's the sort of connections to Montenegro in terms of that. I mean, you have the issues in terms of the industrial relations in your countries, no? And then it's probably very much related to, how the unions operate. So I think it's not really negative message. We see in a lot of countries that there is a movement outside trade unions being developed, fighting for their rights, and they become a part of the trade unions, no? So I think that's quite important to be able to express the workers' demands on the various level, if the collective bargaining and social dialogue is not working. But if you really look at Poland's situation, that we see like 10 years ago, the social dialogue stopped, there was a demonstration, now it's there again, but it's not working. So I think that's this issue, so how we could support social dialogue. In terms of the workers not being able to join the unions or not trusting the unions, I think they also don't trust political parties, so it's an issue about the trust of institutional organizations, no? But I wanted to say something else, because we are here in a quite interesting position, thanks to Jorge or Jorge, I don't know how to pronounce it, Jorge, because everyone is making mistake with your name, sorry. Is that with Marta Branca, we represent those better educated workers, means like doctors, healthcare assistants, nurses, and maybe also cleaners as well, which have the, you know, the rights, the collective bargaining, have better protections, and then you have suddenly on that side those who are completely, as Mark said, neglected, no? And this is really like this hidden workforce, which is also part of that. But if you really look about from the perspective of the nurses or healthcare sector, and if you look at, for instance, in Germany, we see that as a result of the COVID pandemic, the workers were joining the unions more because they really knew that at the time of the COVID pandemic, they need to join the union. So I think I don't think it's a general issues. I think it's quite of the sectoral issues whereby you have no choice if you are a cleaner, and no one wants to be a cleaner, sadly, or if those sort of sectors which are better protected because it's of course majority of this public sector, then the workers are joining the union. There was also another issue during the COVID pandemic that you cannot really join the union because you cannot go to work. So you know how it could be together. I want to also make one comment here, which was also mentioned by the colleague from the Business Europe, that you know, and I really need to highlight, coming from Poland, we do not have enough employees representation. We don't have a strong employees representation, and it's really important. We have a project with Marta Branca on that in Central and Southern Europe, how we could support strong employers organization in order to bargain, no? Because that's an issue. And suddenly there is a good point in terms of on the European level, we will have a new sector social dialogue in social services, no? The 44th after 10 years, we are there, also UNI is there, and I think it's important to celebrate that we could deliver something on that, to have a sector social dialogue. But Mark, then, I think, do you want to say something?
Just very briefly on the point that was raised by our participant from Montenegro, whom I thank for giving us the perspective that we tend to speak about ourselves and among ourselves, but then there's also reality out there. I mean, and because we are social partners, we all agree on this. This one of the beauties, the wonders of the world we live in this side of Europe is the social model that we've built all along these years. And one of the foundations of the social model is precisely that social dialogue is a tool for trying to avoid as much as possible conflict. That's why we're here, and that's our societal mission. We are recognized for doing this. So we have behind us, there is a legitimacy that comes from the fact that we represent whom we say we represent, and someone in this respect, Eurofound, certifies that. And because of this legitimacy, we are here to find the best ways to offer the society as a whole the highest advantages of our discussion in a way that brings everyone the advantages that it needs without stepping into open conflict. Open conflict is necessary sometimes. It's part of human relations, but that's when and how and where social partners step in, precisely to find the right ways to make sure that conflictual approaches that eventually are less than one sum game are avoided as much as possible. So this is probably also a reflection, but it's probably more of a cross-sectoral or more of a political reflection here. So thanks again for bringing this external.
Mark, real quick before we go to the audience.
Yeah, just really quickly. If you look at the directive on adequate minimum wages and collective bargaining, yes, it says, and it's a great opportunity for unions to raise the collective bargaining density to 80%. But for example, what is happening in those sectors where union density is very low? There's no kind of obligation for member states to propose like sectoral action plans, for example, in those sectors that are categorized as low. Or what are we doing about trade union access rights to workers? In the European care strategy, we see there's more focus on care in the community, home care, etc. But it's very, very difficult to for unions to access workers and workers to access unions in such settings. And I think we need to I think we've resolved the top-down kind of social policy element. And I think in the second step in the coming legislative period, we really need to tackle the bottom-up approach. So we re-enfranchise, if that is a word, and we have an inclusive kind of industrial relation system that allows workers to empower themselves, allows employers, organizations to build stronger organizations. I think that is really key to the future if we want to solve some of these issues at hand.
Okay, I know that gentleman there. Yeah, if you want to.
Yeah, hello, good morning. Thank you to the ILO and Eurofound for organizing such an important discussion. My name is Sergi Keral. I'm the political secretary of GEOPA, which is the European Employers Organization for Agriculture. So very much part of the essential critical sectors. I would like to pose a question to all the social partners at the panel. We have been presented with a situation that seems to have very little solutions. No one wants to work in sectors that are essential, so they must exist for the continuity of our society. But employers, we often see how we cannot solve staff shortages with higher salaries because we simply do not have the money for that. Mark, you have put it on the table. Thank you for that. The cash flow of our sectors is often very low, especially in agriculture, where farmers are often forced to sell at a loss, which is unheard of in any other sector. But yet we are requested by society to provide these essential services. There is this, perhaps in hospitals, people can understand better why, for example, a doctor can earn more. That I think society understands better, but for cleaning or agriculture, it's very hard to sell our products or our services at higher prices because society still do not understand that has a high value, and they are not ready to, consumers are not ready to pay more for that. So that makes us find ourselves at the crossroads where we don't know exactly which direction to take. And the question is, how can we promote our sectors better in a way that there are better conditions, both for employers and also for employees, better recognition, and obviously that's extremely linked with the attraction of staff to the sector. Thanks.
Thank you. And that gentleman there in the white t-shirt in the back.
Hello, I'm Evert Persoon from the Belgian Union BBTK-SETCA, Socialist Union, and I'm responsible for the healthcare sector in Flanders, part of Belgium, Dutch-speaking part of Belgium. And I want to make a more, political statement or political question regarding to what we heard today and the importance of key workers. I must say I was very pleased to hear in the introduction by the European Commissioner and other speakers after him that we underestimated the key workers and the pandemic caused to us to appreciate their work, and that he also hopes that the applause is not forgotten. So I don't think the model citizen has forgotten the applause and the importance of key workers, but I fear, however, that the policymakers are doing it very quickly. Honestly, we had hoped in a pre and an anti-COVID period with a whole new policy, but I fear the anti-COVID or pandemic era is a bad copy of the pre-COVID era. If we are to believe the signals that European austerity politics is coming back to the agenda, then I fear that our policymakers are forgetting at all levels, from the local to the international level, already have forgotten which are the key workers and what they did. In my country, for example, Belgium, large part of the efforts imposed by Europe in recent years have been imposed on the key workers, especially the healthcare workers. Not only regarding to them, but also in education, transport, the delivery sector, and so on, commerce. They're all confronted with a legal ban on salary rises because of Belgian policy in executing European austerity policy. I fear that is coming back again to us the next years. The saving the Belgian government has to make to meet the European conditions have always partly been made in the healthcare sector. And these savings in a sector without making savings on the key workers themselves is impossible. So these years of sustained cuts have resulted in our sector becoming underpaid, hyper-flexible, and unattractive to work in. So we are kind of coming in a negative, vicious cycle. Some of the sectors, the social profit sectors today in Belgium, even in one of the most prosperous regions in Europe and the world, are in existential crisis. So the solutions politically being proposed today are a direct consequence of a neoliberal agenda, which is still being pursued in both in Belgian and European policies. So the solutions that are brought to us today are the same bad solutions that were brought to us before the pandemic crisis, and that caused the existential crisis of our sectors today. So we have international competition between EU's member states. We have no level playing fields between sectors in terms of social rights and between countries, and social dumping within the borders of the European Union. For example, in the transport sector. This is still rife today. So the cuts and measures of making work-life balance possible in Belgium are not a matter of scientific needs, but are a choice that has been made by political parties and political representatives. So I would really like to take the opportunity today to call on all policymakers, employers, and trade union colleagues. If we really believe in the power and the importance of key workers, invest in them, respect them, stop skimping on them, harmonize social rights within the EU to get to the best level, and get financial resources where they are, and invest them in those sectors via public services or via government-controlled distribution, via subsidies, to not-for-profit companies who lack these means. So in conclusion, for me, there are two important decisions to make. Stop the austerity policies, and second, invest in key sectors that divide these means via collective bargaining between unions and employers in a non- or social profit sector. I don't know if you want to react to that, but it's more a political statement from my behalf.
Thank you very much. Who would like to, Marta, do you want to respond to that, or would somebody else, or what would you like to, yeah, that statement, yeah. Yeah, go on then.
Thank you. I would like to respond to that statement because I'm also a member of SETCA, so just like I'm happy to have a colleague here from the same trade union. One thing is, this is what we said here, no? I mean, that's the problem. There was applause, we said we do a lot for the key workers, and then, we suddenly, I think, forgot about them because of the war in Ukraine, because of cost of living crisis. Last year with EPSI, we have a demonstration in Brussels on the 9th of December to actually present our demands. But I think something is happening, so we learned the lessons. One thing is that we are speaking the same voice, not only as employers and trade unions in terms of avoiding austerity measures. No, we are saying this loud and clear that this is an investment, so the healthcare sector should be protected from any cuts in the sector. We also see the change on the global level. There is a WHO working now on the pandemic treaties, and this pandemic treaty will have a special sections related to the healthcare workforce. And you need to bear in mind that WHO as a United Nations organizations had before that only one treaty that was about the tobacco. Now they are working on a new one. And WHO is saying loudly and clear that this sector needs to be excluded from any austerity measures, so any cuts. We also have, and the Belgian presidency, which is forthcoming, will be working on the staff shortages in the healthcare sector. But again, that this is only healthcare sector, so we're quite lucky with having the support for healthcare sector. But as you write, and maybe Mark, you could comment this. Yeah, that's other sectors. I don't think it's enough done. I could only speak about the healthcare sector here. Thank you.
Okay, thanks a lot. Just on that gentleman then from the farmers, employers, George, do you want to take that point that he was making, that it's very difficult for employers then to pay more to employees, to farm workers. I think was one of the points that you'd made in your presentation about how if it is not just payment that would make people content in the work, that it's obviously quality of jobs. It was just would you like to make a point or?
Well, not a point. I think someone from the sector would know the sector better than I do. But something that we see from research, from the data that we capture, for example, in the working conditions survey, which Eurofound has been carrying out since 1991. So every 5 years, we try to understand a little bit better what's going on beyond pay. So it's all the aspects of working conditions, of job quality, and so on and so forth. And we know that agriculture is a difficult sector in terms of physical demands, in terms of physical risks. So those are, if you remember the picture we had there with the demands and the resources on the both sides of sort of a scale, agriculture is certainly a sector which is heavy on the side of the demand. So we have to kind of rely on, for instance, technology, machinery, and things to help workers do a better work, a good work, without suffering much from that kind of demands. But then it's a matter of finding the resources for that. But as we know, agriculture is a sector which is heavily dominated by SMEs, very small companies, if companies at all, individual agricultures and so on. I mean, the resources in terms of financial terms and resources available from the employer's point of view, they are also short. Yep. So it's a kind of a bit of a conundrum that we see ourselves there. But it's the essential of the essential, right? Without food, how can we function as societies, right?
Mark, did you want to? Yeah.
I can just give an example from our sectoral social dialogue in cleaning, where we face similar issues, and Matteo can complement that. So during at the very beginning of the pandemic, UNI and FC signed a statement on COVID-19, which of course focused on the essential nature of the services and the work, etc. But following that, we actually had very strategic discussions amongst ourselves about, okay, which routes can we actually, or which opportunities can we seize upon? And I'm coming back to these realignments that I've discussed around social and cultural and political, etc. And one of the things is that we clearly saw during the pandemic that public procurement and public money was given to like all kinds of people to, provide COVID-19 testing centers, to provide masks and personal protective equipment without any kind of social conditionalities. And we really put forward, public procurement. We need to strengthen the social conditionalities on public procurement in the European Union. That also includes a revision of prices when inflation hits the levels it has. So I think, and we have a joint statement on that and joint activities, and Uni Europa has a campaign. And then on the cultural level, talking about the work, we actually as social partners signed a declaration on daytime cleaning. And I have some postcards here that we produced, in which we also call upon the European institutions to implement daytime cleaning across all its operations in order to provide visibility. And here you have a postcard with in back a cleaner saying something to Roberto Mazzola, President of the European Parliament, and a link to Uni's study on daytime cleaning. And we've made advances even within our own trade union movement on daytime cleaning, because now the ETUC is opening up a new building and they are saying, we're going to use daytime cleaning as well. You would have thought that they do it before, but at least we're moving into the right direction on these questions, because that will provide a greater visibility. And I think without COVID-19 crisis, and that was a very strong point the employers made to me, this is the moment, to really create a long-lasting visibility. And I think that goes beyond daytime cleaning as one mechanism through which we can, lever different issues within the cleaning sector.
Janine, you wanted to come in there from ILO.
Yes, I wanted to reflect on the question about the agricultural sector. So in our report, we focused on the investment part. We focused on two sectors. One was the health sector and the other one was the agricultural sector. And this was more focused on the global south. But what we see in the agricultural sector, first of all, is there's a huge financialization of commodity prices. And so this is affecting farmers all over the world, where you see prices going up and down and huge volatility in a way that's just not sustainable for the farmers. So one thing is really about, let's address this financialization of the commodity markets and do something about it so that there can be some sort of predetermined prices that agricultural farmers are guaranteed. And there are some countries, Brazil has experimented in having some sort of guarantees for farmers. All of this is really important. The other issue, less of an issue in Europe, is certainly of an issue in many parts of the developing world, is really also about investment. So cold storage, all the infrastructure that is needed for farmers to get their food from the farm to the market and at a price that's decent for them. So there's really a lot to be done in terms of investment.
And we're going to have to wrap up soon. So I'm actually just going to go to our panelists to see if they have any last thoughts. Marta, I'd like to come to you first.
I think that occasions like this are really important to underline the role of social dialogue to put together different actors like politicians, employers, trade unions, researchers, and I think that we together for us the importance of we understood the importance of this kind of workers, and we all of us with different roles can manage to better discuss and find solutions, but only working together. I think that, as Adam underlined, the fact that we discovered to have the same thoughts, the same voice to overcome these problems, it's just a better starting to reach our goal. That is the same goal. We only have the different ways to find a solution, but we have the same, absolutely the same goal, no? That is find better working condition for our workers, because we as employers are absolutely interested in have high quality care for our patients. So it's only a way to work together that will allows us to reach our goal. Thank you.
Yes, I think we are speaking the same voice with Marta. And at the Jorge presentation, George, you could actually see that it was quite embarrassing because the trade unions were saying about staff shortages and probably COVID as an occupational disease, and the employers were saying the biggest problem for them is pay of the workforce. You know what I mean? So we could actually see that we are thinking the same issues, because we need to have more money coming from the state in order to pay for the wages for the workers, because they are really in public sector, they're really dependent. No, but what I wanted to highlight here, and I think it's important having here also a colleague from Business Europe and myself coming from Central Eastern Europe, we need to have a better capacity building for the social partners across Europe, because we need to have some tough rules, and that's the minimum wage directive is a good one in a sense, in order to support trade unions and employers on the national level and the European level to negotiate. We negotiate now the policy orientation, but we really need to look at Central Eastern Europe, because to be honest, there are good employers who are here and there are bad employers who are not in the European Social Dialogue Club, some of them, you know what I mean, in this sort of sense. So we really need to support those social partners who believe in social dialogue. So the capacity building, I think it's important, and hopefully we could use this directive in order to strengthen the collective bargaining. So that's all from my side. Thank you.
very rapidly. Thanks again for having us here and for sparking this exchange. That's what social dialogue is precisely, I would say, and this is probably a personal position, so don't quote me necessarily. Social dialogue is the opposite to politics. And it's very important that political discussions stay away from the social dialogue, because we are here on the field and we are discussing what works and doesn't work on the field of our work, and we should avoid having reflections or ideas that go beyond the reality of the facts that we are faced with on our field. We have a different legitimacy as social partners, and we have this recognized. The European Commission lately has been, repeating over and over the outgoing, and we hope that the next one will have the same political support for the work that we do, not only political but also financial and institutional, in terms of how the space we have to do this at national level and at European level. So I follow your request in a way to make sure that through capacity building, our representatives at national level can do their work, are recognized and can do their work, and we get the same at European level, because social dialogue is precisely the best forum for us to find solutions, keeping non-work related, not employment, not sectoral related issues outside, out of the door. Thank you.
Mark.
No, I would never be controversial, would I? So when I was in Italy this weekend, the demonstration slogan was La Via Maestra, the high road. And I think we've outlined a high road strategy here today that actually works for workers and that works for employers, and that strengthens the European social model. And I think that that's something really important that we need to take forward with as we go into a new round of elections coming up in 2024, where we will see more scapegoating against immigrants. We will see that more labor market flexibilization is on the agenda from far-right and extremist organizations, and where we will see that, more, populist kind of sloganeering. So I think that's really important from my side going forward.
Thank you so much. And thank you very much for everyone who joined. Thank you to the panel. What were you going to say? Oh, sorry. That's right. Marta Branca, Matteo Matarezzo, Adam Rogalewski, and what should I say? Oh, yes, Mark Bergfeld. Sorry, not to forget you, Mark. Okay, thank you very much. And there's light lunch downstairs at 12:30, and have a lovely day.